So now that we know there's a big question mark about whether these drugs even work long-term, let's shift gears and talk about the more frightening idea that antidepressants might actually be making people worse in the long run. And here's what many of them were saying, because by the 1960s and 70s, psychiatrists started to note that patients on long-term antidepressants weren't relapsing less. They were actually relapsing more and faster. Van Schellen, who concluded after studying 94 depressed patients that it was evident, particularly in the female patients, that more systematic long-term antidepressant medication with or without ECT exerts a paradoxical effect on the recurrent nature of the vital depression. In other words, this therapeutic approach was associated with an increase in the recurrence rate and a decrease in cycle duration. Essentially, he's saying these patients are getting depressed more frequently when they're on antidepressants. And these two professors hypothesized that long-term antidepressant medications were leading to maladaptive changes in the brain that were worsening the course of depression over time. And yes, there is. So one good way to look at this is to look at population trends with suicide and antidepressants. If antidepressants were effective, you would expect to see suicide rates decreasing as antidepressant use went up. But if they made people worse, you might expect to see the opposite.